I believe that, as Stonewall has said, that if there are some recommendations that are implemented properly, then they could make a difference to young people's healthcare.
But that's just a line of her evidence. She says, remarkably weak evidence to support gender treatments for children. Do you agree with that or not? You can take time to consider the ramifications for Scotland, but as a point, that's the point she makes.
What I agree with, and you're right, it's a substantial thread actually throughout the Cass report, that there is not the level of evidence that's required for, she says, for certain treatments. We will have to give that consideration. It's often been my view, and I think it's the view of most people in the country.
While that's being considered, surely it's better to remove puberty blockers in the meantime.
Let me finish this point, and it's actually central to the question that you're asking, is that I've always been of the view that it's for clinicians to decide what is prescribed or not prescribed, not sensible for politicians, First Ministers, Prime Ministers or others to decide what is prescribed in terms of somebody's healthcare or not.
Yeah, so very much review underway there. 32 recommendations within that report published last week. One of them is including changes to care for under 25s. Could that cause a political row here? The Scottish Greens, who are in government with the SNP in Edinburgh, have said they will very much oppose that if that was one of the recommendations to be adopted here in Scotland. No timeline either of when we'll get an update. But is there going to be a further row on this? We'll have to wait and see.